Hey, thank you so much for joining me today. So before we dive into some questions, just take a moment to introduce yourself.
So I'm trying to get this. Can you get? Oh, there we go. Hi, my name is James Chappuis. I'm MD. I'm an orthopedic spine surgeon in Atlanta.
Awesome. Thank you so much for joining me today, James. So tell me a little bit about how long you've been in the Atlanta area and how long you've had your practice.
Yeah, I moved to Atlanta after my training in 1987, and I practiced with an orthopedic group at Kennestone Hospital for 4 years. And then I started my practice in 1991. And so we've been in practice ever since.
Awesome. So you guys have expanded fairly significantly over the long term of your career there. So what are your goals for long term? What do you see for the future in the practice?
Yeah, that's a good question. We want to expand our footprint in Georgia and the Southeast, but I think our biggest goal is to maintain a patient-oriented practice that really looks at patient care and first. And we're in the midst of a lot of corporate takeover of healthcare now, and we don't want to lose the personal touch that we can still provide in the type of practice we have.
Absolutely. So being so patient focused, you're obviously very thoughtful about who your ideal client, who your ideal patient is. Who would you identify? Who are you there to help?
We're here to help any patient, adult patient. We don't treat pediatrics, but any adult patient who's in disabling pain, neck, back, arms, legs, any patient who's had previous spinal surgery and is still in pain. That's really our main group of patients that we focus on.
Awesome. Awesome. So you've been at this for quite a while, had a lot of experience. This is one of my favorite questions as we do this series. So what is a mistake that you've made or a lesson that you've learned through your history that any other business owner could learn from, irregardless of their industry?
Yeah, that is a good question. Being a surgeon, I really didn't want to focus as much on business as I did taking care of patients. I have a number of patents. So I turned over the practice to a CEO about 5 years ago, 6 years ago now. And really, I just really didn't want to deal with a lot of the business aspects of it. But what I realized is if it's your business, you have to stay on top of it. You have to get weekly reports, monthly reports. So I learned, and I guess the basics is, you have to make sure you have good cash flow. So we had a little hiccup 4 years ago. We've corrected that. We're back on track now. So I would just say that you've got to have a solid management team. You've got to have checks and balances in place to make sure you have someone looking over your back if you're not that interested in the business side of things.
Absolutely. Absolutely. So through that process and learning some of those lessons, did you have a great coach or a great mentor that stood out for you? And if so, why would you say that person?
Yeah, there's two that really stand out to me. One is Dr. Terry Canale. I trained at the Campbell Clinic in Memphis, and Dr. Canale was one of my mentors then. He was a past president of the American Academy of Orthopedic Surgeons, but he always taught me to put patient care first. He taught me integrity and character when it comes to patient care and just life in general. So he was one. The other one was Dr. James Andrews, who's a sports medicine orthopedic surgeon in Birmingham and now Pensacola. Although I didn't do sports medicine, he was always an inspiration just on how he handled his patients, how he handled his fellows, how he handled his staff. Just a cool guy, a doctor's doctor. So those two men were probably my biggest mentors.
Perfect. So obviously you have some lofty goals expanding throughout the Southeast. What does the future look like for your practice, and what are some challenges you see as you continue to grow?
Hey, I think our biggest challenge, as it is, I think, with most independent physicians and surgeons, is how to continue to practice despite decreased reimbursement and increased costs. And what's happening in so many practices now, they're either being bought out by private equity groups or hospitals, or they're merging. And I have a bit of a problem with the corporate takeover of healthcare in America. I just think there's a certain limit to what corporate America should be involved with. I don't like seeing them involved with healthcare. I don't want to see them involved with my church. I don't want to see them involved with education. So I think we're in a really tough time on how do I navigate as a physician and continue to provide good ethical care in the midst of a publicly traded company who has profit margins they have to meet, and then tries to set standards that may dictate how we as physicians can take care of our patients.
Absolutely, absolutely. You feel like you lose a little bit of the ability to have that personal touch with your patients in that scenario.
Well, you really do, because now you've given up control. And what's the goal of any publicly traded company? To continue to improve and make more money. So that means pushing physicians and other providers to do more, to spend less time with the patients. And you hope not, but pushing different procedures that maybe aren't indicated. So I think we're approaching a really tough time for both patients and for healthcare providers.
Yeah, yeah. So you touched on it a bit earlier, but if you were talking to a new individual that is trying to start their first business today, whether it be in the medical field or any other field, what would be your number one piece of advice you would give them?
Yeah, that's a good question, because I've looked back and I think here's the basic. Interview and find a really good attorney, one that's going to be with you, work with you as time goes on. Interview and find a good accountant that can work with you, that understands your business, and then develop a strong relationship with 2 or 3 bankers, because obviously you're going to need money to start and grow your business. So those would be my 3 pieces of advice.
Yeah, building that core team around you as you launch your business is extremely important.
Yep.
So how can people learn more about you or learn more about your practice? What's the best way to get in touch?
Well, we have a website, Spine Center Atlanta. And we also have Tracy Hinnant, who works with us. She's a good source. By email, I'm always happy to respond to emails. Uh, yeah, and we have a pretty big social media presence too. So Instagram, Facebook, we're on all those.
Perfect. And I'll provide links for all of those in the description of this video so people can easily find it. So my last question for you is just what most inspires you as you continue to move forward in the business today?
That's a good question. And for me, it's watching a patient who's been in pain, whose life has been disabled because of the pain, after surgery, get up, walk, and get their life back. And the look in their eyes after that inspires me every day, and it's why I keep coming back.
Yeah, absolutely. Making a meaningful difference in their lives.
Absolutely.
Awesome. Awesome. Well, thank you so much for joining me today, James. I really appreciate your time. Thanks for sharing some of your insight and your experience, and I hope we can all learn from it.
Yeah, thank you. Thanks for having me.